Hello everyone! Many of us get worried when we feel a lump in our neck, and often, it's a thyroid nodule. Today, let's talk about the most common type of thyroid cancer, which is Papillary Thyroid Carcinoma, or PTC. This is a type of cancer that starts in the thyroid gland, a small, butterfly-shaped gland located in the front of our neck. Its job is to make hormones that are important for our metabolism, energy, and growth. PTC is called papillary because of how the cancer cells look under a microscope like tiny fingers or papillae. This is the most common thyroid cancer, making up almost 80% of all cases. Usually PTC grows slowly and has a very good outlook, especially if caught early. While anyone can get it, it's more often seen in women, especially those aged 30 to 50. But let's not be too relaxed, because it can also affect children and older people. The first sign is usually a lump in the neck that doesn't hurt. Sometimes there are no symptoms at all, and it's only found when someone gets a checkup for another reason. For example, I had a patient named Ailing Maria, 45 years old, who just had a neck ultrasound because of shoulder pain. And that's where a small nodule was found, which turned out to be PTC. One of the questions I often hear is, "Doc, what if many lumps or nodules are found? Is that more dangerous?" This is called multifocal PTC, where there is more than one tumor inside the thyroid gland. In some cases, having many lumps can increase the risk of the cancer spreading to nearby lymph nodes or glands. This is different from unifocal PTC, where there is only one tumor. Because of this, closer monitoring is needed if the cancer is multifocal. We need to remember that every case is different, so regular checkups with your doctor are important to know the right treatment plan. Being exposed to radiation, especially when young, is one of the known risk factors for PTC. Having a family history of thyroid cancer can also increase the chances. But in many cases, we don't know the exact cause. What's important is early detection. If you notice a lump in your neck, hoarseness that doesn't go away, or difficulty swallowing, don't hesitate to see a doctor right away. Early tests like ultrasound and biopsy are key for successful treatment. Let's not ignore any changes in our body. Is it true that PTC spreads if it's not removed right away? The answer is yes. Even though it grows slowly, there's still a risk that it can spread, especially if the nodule has been left alone for a long time. The first place it often goes is to the lymph nodes or glands in the neck. When cancer cells have spread to the lymph nodes, this is called regional metastasis. The longer it takes before surgery, the higher the chance of this happening. Think of Cardo, a 60-year-old patient who had a lump in his neck for 10 years but didn't pay attention to it because it didn't hurt. When he finally got it checked, it had already spread to the lymph nodes in his neck. It can affect the left or right side of the thyroid, or sometimes both sides. PTC can spread not only to the lymph nodes. In rare cases, especially if it's a more aggressive type or has been left alone for a long time, it can spread to distant parts of the body. This is called distant metastasis. The most common organs affected are the bones and the lungs. When this happens, treatment becomes more complicated. That's why it's very important not to ignore any lump in the neck, no matter how small or how long it's been there. Is it dangerous for young people? While it's more common in middle-aged people, it can also happen to children and teenagers. The good news is, even though PTC in children can be larger and spread more often to the lymph nodes, their overall outlook or chance of getting better is still very good, often even better than in adults. What's important is the right treatment and careful monitoring. Let's not be scared, but we need to be careful and watchful for our children's health. The question is, how fast does it spread? There's no exact timeline because it depends on many things: the patient's age, the size of the tumor, and the specific type of PTC. Some types of PTC are more aggressive than others. What's important is the principle that early detection saves lives. The sooner it's removed, the lower the chance of it spreading. Let's not wait for the lump to grow or for symptoms to appear. Regular checkups, especially if you have risk factors, are a big help in keeping us healthy and at peace. The main treatment for papillary thyroid cancer is surgery. Depending on the size and if the cancer has spread, the doctor might remove only half of the thyroid, called a thyroid lobectomy, or the entire thyroid gland, called a total thyroidectomy. If only half was removed and the remaining part is healthy, is this safe? Yes, in many cases. The remaining thyroid can continue to make enough hormones for the body. However, Regular monitoring through ultrasound and blood tests is still needed to make sure no cancer comes back and hormone levels are good. But what if the entire thyroid gland needs to be removed, or a total thyroidectomy? This is often done if the tumor is large, if it's multifocal, or if it has spread to the lymph nodes. When the thyroid is gone, the body can no longer make thyroid hormones. This is where the effect on our hormones and metabolism comes in. Thyroid hormones control how fast our body uses energy. Without it, our metabolism will slow down. We might feel very tired, cold, gain weight, and have dry skin. It's like a car that ran out of gas. It won't run properly. To avoid these problems, patients who have had a total thyroidectomy need to take medicine every day for life. This medicine is called levothyroxine. It's a man-made thyroid hormone that replaces the natural hormone that was lost. This is safe and effective. It's very important to take it every day, usually in the morning, half to 1 hour before breakfast, to make sure it's absorbed well by the body. The right dose is different for everyone, so regular blood tests are needed for your doctor to adjust it. Think about the story of Mrs. Susan, a teacher who was diagnosed with multifocal PTC. She had a total thyroidectomy. At first, she had a hard time adjusting, but with the help of her endocrinologist and by regularly taking levothyroxine, her energy returned to normal. Now she's active again in teaching and taking care of her family. Taking the medicine has become part of her daily routine, just like brushing her teeth. Life goes on and can be normal and productive even without a thyroid gland, as long as there's proper treatment and discipline. After surgery and starting hormone replacement therapy, it doesn't end there. The next step is regular monitoring. This is very important to make sure hormone levels are controlled and to catch any returning cancer early. Your doctor will regularly ask for blood tests to check your TSH, or thyroid-stimulating hormone, and thyroglobulin, or TG levels. TSH tells if your levothyroxine dose is correct, while thyroglobulin is a protein made by thyroid cells. If the TG level is high after surgery, it might be a sign that some thyroid tissue was left behind or that cancer has returned. Besides blood tests, regular neck ultrasounds are also important. This is to check the area where the thyroid used to be and the lymph nodes in the neck to make sure there are no suspicious growths or lumps. The frequency of these checkups depends on your risk level. At first, it might be every 6 months, and as time goes on and results remain good, it might become yearly. Following this follow-up schedule is as important as the surgery and taking medicine. This is your safety net for long-term health. Let's remember, papillary thyroid cancer has a very high survival rate. It's one of the most treatable types of cancer. The diagnosis might be scary at first, but there's a clear path to recovery. The key is early detection, proper treatment, and careful monitoring. Let's not be afraid to ask our doctors questions. Be an active partner in your own health. Understand your condition and the treatment plan. Knowledge gives power and removes fear. So for everyone listening, my message is full of hope. If you or your loved one has been diagnosed with PTC, remember that you are not alone and there is effective treatment. Follow your doctor's advice, take your medicine regularly, and don't forget your follow-up checkups. Life after thyroid cancer can be just as good, if not more meaningful. Stay positive, be watchful of your health, and trust the healing process. God bless you all.